Much. Good morning, viewers. We welcome you back again to monitor your health. My name is Dr. Femi Ogunremi. I am the host for this program. The topic we're going to try and trash today is around children and diabetes. There are a lot of questions that we need to answer. In order for us to do justice to this, we have a capable physician in-house, Dr. Kayode Adeniran. Dr. Kayode Adeniran is a consultant pediatrician and also an endocrinologist. I will allow him to tell us a little bit about himself. Dr. Adeniran, welcome to the show.
Thank you, Dr. Femi Ogunremi, for having me on your program. Like you have said, my name is Kayode Adeniran. I'm a specialist first as a pediatrician. Then I am also a pediatric endocrinologist and also a fellow of the European Society for Pediatric Endocrinology. Thank you.
Thank you so much for giving us the time. I know it's very, very challenging, even chasing you up today in between meetings and that, because I know there are only a few of you in the country. We really appreciate this time. So today we want to talk about pediatrics in children. We want to talk about diabetes in children. So what is diabetes in children really?
All right. I think the first thing to say is that a lot of people don't think it exists, but diabetics in children is when you have what we call hyperglycemia, which is high blood sugar as a result of either inability of the body to produce insulin in adequate doses, or if there is insulin, but the insulin is not acting. That's what we call insulin resistance. So based on these two, insulin availability, either very reduced insulin or insulin is there, but they are not active, then we say the patient has diabetes.
Okay, thank you so much. So we've heard the word insulin, and I know that some of our viewers will be thinking, "Whoa, what is insulin? What are we talking about here?" Can we break that down a little bit? Can we understand what insulin is? Why is it important? Right. We have to have it. Why is this balance very important?
Okay, so insulin is a hormone that is produced by the pancreas. There is an organ in the abdomen called pancreas, and there is a part of the pancreas is called islet cells. So this produces a hormone that is insulin, and insulin is important in ensuring that when we eat our food, the food is broken down into sugars. Most of our food are either in protein or carbohydrate or fat. And at the end of the day, the body utilizes sugar. This sugar, you have them really in two forms. You have the sucrose and the lactose. So the sucrose, you have glucose and fructose, and you have glucose and galactose for the lactose. So when it's broken down after being absorbed, the unit of currency for the cell to produce energy is glucose. And for glucose to enter into the cell of the human body, you need insulin. So I would just say that insulin is the key that opens the door for glucose from the bloodstream to enter into the cell of the body and produce energy for metabolism and sustenance. Thank you.
Thank you so much. So I hope our viewers can understand what we're talking about here. So what our doctor is saying is, for the body to work, to function, you actually need the energy. The energy comes from things that we gain from the food that we eat. So when we take the food as solid as it is, it breaks down into some small units, which is what he's talking about. And this unit is what gives us the energy. But that unit will not work until it gets into the cell. So the key to move that unit from the blood into the cell is the insulin we're talking about here. So exactly. I think that's a bit, so now we know that if we have inadequacy of this insulin in the body is what leads to diabetes. Now, diabetes in children, it's kind of a big thing that, it ponders around my head. I just look at it. Children will start from age 1 day to, I don't know where you benchmark it there, but from age 1 day to 10 to 11 to 16. So how do we know? Because a child of 2 years, of 2 days, do we mean they can have diabetes? Or what are we talking about here?
All right, thank you, Dr. Ogunremi. So it takes us to the classification of diabetes mellitus. So the commonest form of diabetes in children is type 1 diabetes.
Okay.
And of recent, due to urbanization and westernization of our living and our meals, we are beginning to also see type 2 diabetics in children and adolescents. Then it's going to be surprising to a lot of people that even there is neonatal diabetes. And when you say neonates, you are looking at a baby that is born between the first 20 days of life. A baby can actually have diabetes. And also there are other things that can cause diabetes like drugs. And that's why it's not good to go and abuse drugs. If you are using steroid can actually lead to diabetes. So in a nutshell, we can look at it. There is gestational diabetes that's in the mothers. But for children, like you said, from the time the baby is born to 16, 18 years, that is our purview to take care of those children.
Wow.
Thank you.
Okay, thank you so much. So it means that diabetes can happen at any age, even in pregnancy. When they're still yet to be, to be born, they have the propensity to actually have diabetes. That's really, really, frightening in a way, and quite interesting to also know. So if we now say that, okay, this thing can happen at any age, between age 1 day to age maybe 16 years of age. Are there signs, are there things that we need to look out for at this different age group? And then obviously we talk about type 1, obviously, and then type 2. We might come back to that later. But what are the things that we need to keep our eyes on to know if our child or children are developing diabetes?
All right, so like we said earlier on, I want to tie this to what we call pathophysiology or pathogenesis. So right. When you don't have enough glucose within the cell, it means that you are not producing enough energy. So one of the things that people always first present with is lack of energy, easy fatigability or tiredness. So you see a child always sitting around, or the child is not very active. That is one way. But there are many other diseases that can lead to that. But majorly, when you now have a lot of glucose in the blood, what happens is that this glucose starts spilling into the urine. And when it starts spilling into the urine, it begins to take water with it. So the patient starts urinating excessively. That's the child starts urinating excessively.
Right.
When the child starts urinating excessively, the body reacts by the child. You have to, because so much water is coming out of the child, the person has to take enough water. So he starts taking so much water to balance so much water that is going out of the urine.
Right.
Then another thing that is important is that when you are not producing energy, you begin to burn your fats and your protein. So the person starts losing weight if it's an older child. But if it's a newborn, the newborn will be failing to thrive. That means the child will fail to gain weight. Then a child, for example, who has already achieved dryness, who is not bedwetting, suddenly starts bedwetting, then you begin to suspect that this child has diabetics.
Okay.
Thank you.
Thank you so much. So we can say to our viewer, you can hear what the doctor is saying here. It's very important for us to be very, very vigilant with our children, because things that we might just think, oh, it's malaria, oh, it's this, oh, it's that. And then we sit on things, sometimes it might be too late. So if we see signs, especially in kids, things that are worrying to us, it would be good for us to get our doctors to get your child checked. So as simple as a child is not very active, is not becoming a major thing that we're now looking at, could there be diabetes? So thank you so much, Dr. Adeniran. I think some questions are coming in as we're going. I think it might be good for us to, okay, we'll get back to this. This question is something that we're still going to tackle later. They're asking, does diabetes in children have a cure? So we'll get back to that in a minute. Okay, so we talked about some interesting things earlier on. So you talk about, different types of sugar that we have. And then you talk about a lot of sugar in the blood. Now, what we normally believe is you need this sugar to actually, to function. But you now have a lot of sugar, a lot full of sugar in the blood, but the body is not utilizing it. That's a kind of paradox. But I know you mentioned insulin earlier on. This is where insulin becomes important. I want to believe that. So glucose and then fructose, I want to touch on that, because we know that a lot of our drinks, a lot of the food that we eat, a lot of things that we eat, they have fructose. Where is the place of this fructose in this whole thing?
All right, so the issue is that I think the most important thing we need to know is that it is always good that we should eat less refined sugar. Right. Generally, less refined sugar. And if we take a lot of refined sugar, at the end of the day, we are likely to gain excessive weight.
Right.
If I want to take it off from what we are saying, that a lot of time, everything we eat, actually, whether it is protein or it is fat or it is carbohydrates, everything goes back to sugar. But like I said earlier on, the sugars, when you say blood sugar, the one we are interested in is glucose. Glucose, okay. You've said that it's actually scarcity in the midst of plenty. There is enough glucose, but it's not entering the cell. So if you have just enough and you have enough insulin, then you are home and dry. That's it.
Okay, thank you so much. So insulin is the key, basically.
Insulin is the key.
That means if you eat a lot of carbohydrates, if you have enough insulin to manage it, that's okay. Is that what we're talking about here? Or do we be thinking about reducing the amount of sugar we're giving our children?
Okay, so the issue is that children need energy because they are still growing. And that's the difference between diabetics in children and diabetics in adults. We don't diet, we don't put our patients on what they call, they begin to reduce portion sizes and all those things. You reduce portion size to make sure that the food of the child is a balanced diet. Because the child is growing, the child needs all these nutrients. Yeah. So it's a war of weight. But it is important that to know that taking too much sugar does not necessarily cause diabetes. Right. Depending on the type of diabetes, it could be as a result when you're talking about, there is a type, like we say type 1, that is when the body attacks self. The type 2 is when there is obesity.
Okay. Okay. So there are two types now. So that we have the type 1 and we have the type 2. So
yes.
And then both of them happen in children, basically.
Yes, both of them.
Or we always hear that the common one or the commoner one in children is type 1. Yes. Is that about right? Or
that's true. Very true.
Okay. Why is that? Why is it that the type 1 is commoner in children than type 2?
Okay, so it actually depends on the climb where you are. But generally, type 1 diabetics is commoner in children because the cause of the type of that diabetes is usually a situation in which the body attacks self. So the body produces antibody against the pancreas that produces the insulin and destroys it.
Okay.
So when it destroys the ability of the body to produce enough insulin. So you have very little insulin, or you have no insulin at all.
Right.
But in type 2 diabetics, it is as a result of increased weight gain, overweight to obesity. And like I said earlier on, because of westernization and urbanization and our life changes, our children are getting very obese, and they produce less insulin, and even the insulin they are producing is not able to act. So you have insulin resistance.
Right. Okay. So that's what leads to the type 2 one.
Type 2. Yeah.
Okay. Brilliant. Thank you so much. So at this point, I think it'll be good for us to hear what people say about diabetes. We try to go out to interview a couple of people. Let's just play this. I'm going to just share my screen so that we can see what we were able to pull out from people, or what we're able to hear from people. So that's my screen there. Let's push this aside. Let me play the first one.
Hello, good morning, sir.
Good morning, how are you?
I'm fine, thank you. My name is Eno for Monitor Healthcare Limited. So this morning, I just want to ask you a few questions. We're actually having a TV talk show titled Monitor Your Health, and today by 12 noon, we'll be talking about diabetes in children. So I just want to interview you and ask you a couple questions about diabetes in children. Do you think a child can have diabetes?
First and foremost, my name is Mr. Samuel. It is very possible that children can have diabetes because issue of diabetes can be hereditary. It can flow from one generation to another generation. So it is very, very possible that a child can get that symptom, that disease from gene. The family gene is transferable from gene to gene. So you examine some family, you trace the history of many families, the lineage is infested with this evil, this sickness of diabetes. So it is very, very possible that you can trace a case of this disease from family lineage.
Very much, sir.
Thank you so much.
So I want to ask another question. What do you think are the signs or symptoms of this disease?
The symptoms of this disease, by medical science, somebody can have the symptom, can be dizzy, dizziness, loss of weight, frequent urinating, for example. Those are the things, and I'm not a medical scientist, but I know by experience with interaction with people that have it, that these are some of the signs.
Okay, thank you very much. And last question, I want to ask, do you think this disease can be prevented?
It can be prevented. The only way that somebody can prevent himself is eating excessive sugar. Excessive sugar can cause it. So somebody really want to prevent all those sugary things, ice cream, many can avoid them. When you avoid them, avoid sugary things, you can prevent it. But we're not saying in the history of medical science that sickness has a permanent cure. It doesn't have a permanent cure, but it can be prevented. It can be reduced drastically.
Okay, thank you very much, sir. So today we'll be having this talk show on our Facebook page. Monitor.
That's fine, thank you. So I'm going to share my screen. I think that one will be fine because the other patient, also the other person that we interviewed, also seems to have about similar view as well. So two things I want to pick out from there. This gentleman said eating sugar. So eating sugar is what causes diabetes. But what we're getting here today from the specialist is that, yes, in children especially, we're not going to stop our children from eating, but obviously we need to balance by way of chemical, which we're going to go into maybe in terms of treatment, balance the insulin level. So thank you, Dr. Adeniran. Now, that will take us into the next, phase. How do we actually diagnose this patient or these people that come up with this? And then how do we treat them? Maybe we take the diagnosis first.
Okay, so in diagnosis, it's the patient comes, the standard of diagnosis is that the patient comes with a symptom. So these symptoms that we have actually said, like the patient is easily tired, the patient is drinking a lot of water, the patient is passing a lot of urine, the patient is eating a lot of food, the patient is losing a lot of weight, the patient is so those are the symptoms. Then of course we examine the patient, and a lot of them have lost weight. Some of them are sthenic, which are more of the part, the type 1, while those that are obese is the type 2, with signs of what we call insulin resistance, which is called acanthosis nigricans, where the nape of the neck has increased pigmentation and thickness. And you now do a blood test. You do a blood test to check the sugars, and you find out that the blood sugars or the blood glucose is very high. And also there is another one we call the HbA1c, which is a glycosylated hemoglobin that can help you to know even if that one is also in both in diagnosis and also in monitoring the patient.
Okay, thank you so much. So so blood test is the key, and yes, obviously we talk about the symptoms and the signs. Yes. So if you start having a situation where your child start craving for food, and they start weighing a lot, they're feeling very, very thirsty, they're losing weight, and they're very tired, you need to let them obviously see a doctor. Now, you talked about HbA1c. HbA1c in our environments where we have a lot of hemoglobinopathy for people at home, where we have different types of blood types that might alter this. How do you match up these results? Is there any special thing that you need to watch out for from that one?
Well, the thing that is like you are saying, there is the hemoglobin A1. Usually is the one that gets glycosylated. Yeah. And when you say glycosylated hemoglobin, it means that when glucose enters the cell, the red cell, it actually attaches to it almost all the lifespan of the cell. The red cell lives between 80, 90 to 120 days. So you can actually look at this amount of it's said in percentage, that if at certain percent, you will know whether that patient has been well controlled or not. This is very, very important for treatment. That's to monitor the patient, and also at some level, it also can be diagnostic. Right. The gold standard is to do a fasting blood sugar. That's the gold standard to do it. That's quite readily available. You fast the patient overnight for between 10 to 12 hours, and you take the blood sugar, the blood, and you test the blood glucose, and it's if it's quite high, be above the normal, then you say that that patient has diabetes.
Okay, thank you. So for neonates or baby, first few days of life, is that the same? Is it the same rule, or is there a different rule for them?
No, for the neonates, what you can't fast the baby, obviously. What you do is a random blood sugar. And for the random blood sugar, you do a random blood sugar, discover the cutoffs. If it's higher than 250 milligrams per DL, then you start suspecting that with the other clinical this. And also do a urinalysis. And when you do a urinalysis, it's checking the urine sample. In the urine sample, I've told you that the sugar starts spilling into the blood. And you also have what they call ketones in the urine or even in the blood. Then you know that this is likely to be diabetes. Yeah.
Okay, thank you. Somebody just asked a question from the public. Children and ice cream in line with diabetes. What's the way out? So ice cream and children in line with diabetes, what's the way out? Let me just ask you, Ro.
Okay, so the issue is that ice cream is it's a form of delicacy that women, a lot of children like, even adults. But I think, I used the word I said earlier on that let your child have a balanced diet. That's the key. Occasional ice cream intake is not going to give the child that is mellitus. You understand it?
Thank you so much for that. Then a lot of things in children, this is one of the questions, a lot of things in children, there's always vaccination. What is the role of vaccination in the management of diabetes?
Okay, so it is very important to know that if you vaccinate a baby, it makes the baby to have less diseases that are seem preventable. So I didn't actually talk about a type of diabetes called diabetes due to malnutrition. If the baby is not well vaccinated and the child have a lot of disease, he can get malnourished. And if this child gets malnourished, the child can actually have a form of diabetes called diabetes of malnutrition. But again, there is what they call the hygiene theory. In the hygiene theory, because of improvements in the survivability of our under fives, and now that they are not having a lot of bacterial infections, they cannot have a lot of viral infections. Now, these viruses can actually be the trigger to what we call autoimmune process. So when we have an autoimmune process, that is when the body begins to produce antibody against self that now destroys the pancreas. So it's while you are trying to take care of certain microorganisms, then you now have issues with other ones. So there is what they call the hygiene hypothesis. So hygiene hypothesis is actually one of the reasons why we are having a lot of type 1 diabetics in our children.
Right. Okay. Wow. Okay. So obviously, this is to the public, as we talked about earlier on, that there are two types of diabetes. Of course, there's a third one now. So the two types is type 1, type 2. Basically, type 1 is when basically somebody has a problem with their pancreas. Pancreas is the organ or the system in the body that produces the insulin, which is, as we said earlier on, is the key that carries glucose from the blood to the cell where the cell uses it up. Now, that usually happens as a result of infection, like viral infection. And we're also talking about the second type, which is the one that is commoner in adults, which is due to, some, maybe increase in body weight, and then your body cannot produce enough insulin, or there's a resistance for the insulin within the cell in your body. So the insulin does not do the job it's supposed to do again. And then you have a lot of glucose in your body. And then when you have this, you start having all the symptoms that we talked about earlier on. Thank you, Dr. Adeniran. So now let's go to how do you tend to treat these children, these kids? Or is there a remedy? Let's even start from there. Is there a remedy? And if there's a remedy, what are the remedy that you offer when a child comes to you with diabetes mellitus?
All right, so I think the first thing is that there is no cure for diabetes as we speak now. Let us just get that. And a lot of time for the type 1, when the process of body attacking self starts, it takes time for you to have significant damage that would reduce the production of the insulin to the extent that it's going to result in the disease. A lot of time, once this happens, it becomes almost irreversible. That's for type 1. But for type 2, lifestyle modification, healthy living, and all those things can actually make you not to have the type 2. I remember when the person the interview was talking, he talked about genes. Yes, truly, there are some genes that have been isolated that can make a person have type 1. And also, we also know that type 2 also have some genetic predisposition to it. And how we know this is that for type 1, if a child has the disease, there is a high percentage that the siblings can have it. And especially if they are monozygotic twins, it's almost like 50% chance. And when you look at the father having type 1 and the mother having type 1, a higher percentage is that if the father has a type 1, the child is going to have it compared to the mother. Then when you look at vis-a-vis the type 2, a lot of time when the child begins to gain excessive weight and sedentary lifestyle and all those things, those are the things that predisposes to it. And when there is a situation in which there is also diabetics type 2 in the family.
Right. Thank you so much. There's always this, this belief amongst our people that we have herbs that will cure everything. And then when people see things that is abnormal, what we normally want to do is to remember that herbs, maybe oriental or something that we need to use to cure things. And there are a lot of, you walk around the street of Lagos, for instance, there are so many people, we have this one, remedy for diabetes and things. Where do we stand with this? Of course, what sort of treatment do you give? And what is the position of all this remedy that people talk about in the public?
Okay, so yes, we know that so many people come and say, oh, they have a cure. We've already told you that the issue is that there is no insulin, either relative or absolute lack of insulin. And you cannot flog a dead horse. When there is no insulin to be produced, there is nothing you can do about it. So the only thing you can do is to give insulin from outside. And there are different forms of insulin that can be given in different ways to simulate the way the pancreas produces insulin in the normal person for type 1. Now, for type 2, because they still have fairly enough insulin, but the insulin is not working well. So what we do is to help the body to bring out insulin from the pancreas and also make the insulin to work well.
Right.
So we give what we call oral hypoglycemic agents. We give some drugs. For type 2, they can use drugs. For type 1, it is injection insulin. But for type 2, sometimes you may also need to give injection insulin for it to work. But in the two of them, lifestyle modification is very important.
Right. Okay. That's one thing I was going to touch on. The lifestyle modification in children. activity. How important is this, physical activity in the control or of diabetes, or even prevention itself?
All right, so for type 1, it is good to know that when the child has type 1 diabetes, it doesn't mean that the child should not be active. Activity actually helps the body to recover, to adapt better. What do I mean by that? When you give insulin, there is a way the insulin enters into the cell. But exercise has another pathway through which it gets glucose into the cell that is not through the use of insulin. So right. It actually helps the insulin utilization. The same thing with the type 2, where you need exercise to reduce the weight and also reduce insulin resistance and increase glucose uptake. Thank you.
Okay, thank you so much. Now, in adults, when we talk about diabetes, we also talk about other things. We talk about blood pressure, we talk about cholesterol, we talk about all sorts of things. What is the position of high cholesterol in children when it comes to diabetes and even high blood pressure, actually?
Okay, so thank you very much. For type 1, most often they don't usually have those comorbidities like the hypercholesterolemia, high cholesterol, or hypertension. But in type 2, when a person is obese, a lot of time it goes with excessive fat storage. That excessive fat storage that you are seeing actually in the face value is also within the blood. So when you do a blood level of the fats, which is the cholesterol, is usually high. And also this leads to hypertension in them. And there are children with hypertension that can be life-threatening. So when we also see these patients, we actually look out for all these things in type 2. But in type 1, what we are looking for is actually other autoimmune diseases like thyroid problems, adrenal problems, and so on and so forth.
Okay. Right. Thank you so much. I believe our viewers are, they're learning one or two things from this discussion. The other thing I want to touch on is, complications. What are if a child has diabetes and we just leave it and then we just carry on as usual, what are the complications? What are the risks that we're playing with?
Okay, thank you so much. So the complications of diabetics is because of the high sugar level. A lot of time it could lead to blindness.
Wow.
It could actually damage the kidneys. It could lead to hypertension. It could lead to the increased blood lipids, can clog the heart vessels and lead to heart problems. Right. You understand? So these are big. Then for some, they can have ulcers that does not heal, because when you have too much sugar, it does not allow healing to take place. So except it's controlled. So they can have ulcers. They can have there's what we call diabetic foods, diabetic ulcers, and so on and so forth. So these are some of the and also some of them may not even be able to attain puberty early because they are small for age. Yeah.
So diabetic foods, that's also something that is of worry in children as well.
Yes, you can get that if the blood sugars are not well controlled.
Okay, all right. Thank you so much. So the big question then comes. We've had all this. We know that truly there's diabetes. We know truly that there are some associating factors that can lead to to diabetes. We know the signs. We know the symptoms. We know that there is no cure. We know that we can either control things, and obviously, if we do not do things right and we do not treat appropriately, we know that we can have complications, even blindness and even puberty problems. So the big question then comes, can we prevent this? Can we really prevent diabetes in children?
We may not be able, we can prevent type 2 diabetics, but type 1 diabetics, largely if one is predisposed to it, may not be preventable. Type 2 with a healthy weight, it can be prevented.
Right.
But the worst one is that the complications can be prevented. Because somebody has diabetics, once you can control the blood sugars very well, and the one is living healthy lifestyle, then the complications may be controlled or pushed further down the line. Yeah.
Right. Okay. Thank you so much. There's one more question from the public. What causes what hits on the what causes it on the foot? Okay, this might not be, well, I don't, this question is quite broad. It might not be directly, linked to diabetes, but I will leave it to I'll let the expert talk about. So what the question now is, what causes heat on the foot?
Heat.
Do you think it's appropriate for this discussion, or we can take it on? So maybe what causes, my understanding is what causes heat on the foot. Maybe some people do have like heat sensation on their foot. So that's what.
Okay. I understand what you're saying. So a lot of time, well, I'm not. This is not common with children, but with my MBBS first degree learning and knowledge, a lot of adult patients can come with vague symptoms in which they will say they find some funny sensation. Now, don't let us forget that one of the complications of diabetes is actually neuropathy. That means damage to the nerves of the body generally. So when the nerves are damaged, sensation becomes altered. So this altered sensation is what this person may be adhering to. So it's one of the complications of too much sugar in the body that damages the nerves, which is part of the complication that you can find even in children, neuropathies.
Thank you so much, Dr. Adeniran. We're getting to the end of this program now. So in like 1 minute, what would be your advice to parents regarding diabetes in children?
Okay, so my advice is eternal vigilance. We've told you the symptoms. Do not take it for granted. Try and see a doctor. If you see a doctor early, most of the complications are going to be mitigated, and the child can have a good quality life. That is the most important thing.
Thank you.
There is no cure. There is no cure for diabetes. We can only control it. Thank you.
Thank you so much. So to the viewers, you say we're getting to the end of this. The aim of Monitor Your Health is to educate us on, common conditions, and for us to know what we need to do to prevent complications, to prevent death. Because we know that there are a lot of things out there that we really would have done the right thing if we know what we need to do. This is the essence of this program, to educate you, to give you, empower you to be able to actually know when you need to take an appropriate step. So as we get to the end of this now, I want to thank you, Dr. Adeniran, for giving us your time. You know how challenging it was today to actually pull you out of your schedule. So we really appreciate it. And to the viewers, please share this program. Let other people that might benefit from it, let them see it. And then we'll be here again in another, I think next week, where we'll be talking about some other important topics. For you to know more about what we're doing, you can actually follow me on Instagram. If you're on Instagram, My Instagram handle is Dr. Femi, which is Dr. Femi Ogunremi. If you follow me, you will be seeing a lot of advert publication. Or you can follow Monitor Healthcare, which is this Facebook link. Thank you so much, and then we wish you the best of the weekend. Have a good day.
Thank you.